Hello everyone, my name is Thomas Nguyen, and today I will be presenting a creative brief on the topic of diabetes. First, I will go over the description and background of the topic. What is diabetes? Diabetes is a chronic disease characterized by the impairment of the body's ability to process blood sugar, resulting in hyperglycemia, otherwise known as high blood sugar. There are three types of diabetes: type 1, type 2, and gestational diabetes. The majority of the diabetes cases, about 90-95%, are type 2 diabetes. There is also another condition called pre-diabetes, in which blood sugar is high but not high enough to be considered type 2 diabetes. How many Americans are affected? The Centers for Disease Control, the CDC, estimates that there are about 34.2 million Americans that have diabetes. And the type 2 diabetes, it will be the main topic of the creative brief presentation. A hallmark of type 2 diabetes is the decreased or loss of insulin activity. Insulin is a hormone produced by pancreatic islet beta cells that regulate blood glucose levels by enhancing glucose uptake into the cells. Thus, with the decreased or loss of insulin activity, the cells cannot uptake glucose from the blood, thereby the glucose accumulate and stay inside bloodstream, resulting in high blood sugar. Now, what happens if type 2 diabetes is left untreated or not prevented? Well, patients become more at risk for stroke, heart attack, kidney failure, blindness, and loss of lower limbs. And treatment can be very expensive, costing people up to $16,750 on average annually. What are some risk factors for type 2 diabetes? Risk factors for type 2 diabetes include environmental risk factors, such as lack of access to green spaces, air and water pollution, and a number of viral infections. Genetic predisposition is also another risk factor for type 2 diabetes. Behavioral risk factors include sedentary lifestyle and a poor diet, high in starch and sugar. An intervention program that has been implemented to improve the prevention and management of diabetes is the National Diabetes Prevention Program. It's a partnership of public and private organizations aimed to make it easier for people with pre-diabetes or at risk for type 2 diabetes to participate in evidence-based, affordable, and high-quality lifestyle change programs. The target audience for the topic is all American adults ages 18 to 44. 14.8 million adults are living with diabetes. And upon research, target audience values family life, household income, career, and spirituality the most. This segment of the population is Americans in their prime working years. And the secondary target audience is the children of the target audience. The objective of the presentation is to provide details on the communication platforms that can encourage the target audience to feel at ease about their options to improve quality of life as well as the lives of their loved ones. Some challenges that the initiative face include personal beliefs, cultural practices, misinformation, biological and environmental factors. Some of the patients may have personal and cultural beliefs in that insulin therapy could be controversial because insulin therapy involve injecting chemicals into your body. In addition, cost of intervention, lack of access, and socioeconomic status can be substantial barriers to implementing this program to the target audience. Now, the key prevention method is that one single benefit that will outweigh the obstacles for the target audience is a longer lifespan. American adults value family life the most, so a longer lifespan means that they have a higher probability of achieving that. Reduced healthcare expenses is another benefit that outweigh obstacles American adults face. Considering that household income is also highly valued by the target audience, saving money on type 2 diabetes related expenses should be a strong motivator. So with that being said, in simpler terms, the target audience should be encouraged to reflect on the message. If I reduce my sugar consumption and or exercise more often, then I will live longer and save more money to help improve my family life. Some support statements include target audience may benefit greatly from the National Diabetes Prevention Program because they already have. The CDC and the American Diabetes Association, or ADA, suggest that the NDPP have been effective in reducing body weight as well as incidence of diabetes. These results confirm that what most healthcare professionals believe to be true. The combination of program intensity and duration are important factors in achieving the desired weight loss goal of 5 to 7%. The tone of the communication platform should be either humorous or emotional or both. In order for the message to be successfully delivered to the target audience, they must first find common grounds with the message. A humorous tone offers a lighthearted approach that can catch the target's audience attention prior to an emotional tone that will leave them a long-lasting impression. Communication channels for this initiative include print ads, television, social media, and religious congregation. Target audience are Americans in working ages, likely to come across a lot of print ads at work. In addition, they are in the midst of a technological revolution, and thus social media is a powerful tool to share all this information. Moreover, religious congregation are functions that center around trusted leaders that can definitely help disseminate health-related information. Some opportunities for the initiative include that print ads, brochures, and other handouts can be given out during work meetings. In addition, other times that this information can be shared would be during the World Diabetes Day or the ADA's Diabetes Alert Day. Another good thing about social media is that it lacks a longitudinal barriers to dispersion of information. In other words, there's never a bad time to reach out to the target audience on social media. Some creative communication considerations include disparity of health literacy. It is a major barrier for effective communication about the intervention program. In addition, the U.S. is a very diverse nation with many citizens speaking non-English languages, and regional differences warrant creative solutions as well. And here is my works cited with all the resources that I've used for this presentation. Thank you very much.